Hello, and welcome back to the Penguin International Podcast. Today, in our episode, we uncover what really keeps hospital running, from patient care to technology, from staff management to crisis response. I am your host Dipanshi, and today we are joined by someone who truly understands how hospital functions from inside out, Miss Iram Fatima, as Senior Executive Product Development and Implementation at Medblaze. With 5 plus year experience in hospital operations, Iram now drives digital innovation to enhance care quality and efficiency. In today's conversation, we will explore how hospital operations are evolving, how technology and AI are reshaping management, and what challenges actually healthcare leaders face on the ground. So let's dive in and discover how hospital operations form the backbone of modern healthcare. Welcome to the podcast, Iram.
Thank you so much. Thank you so much, Dipanshi, for having me here. And it's a pleasure to be here and talk about something which is actually very close to my heart and which most of the people don't know about what operations is. So thank you so much, and looking forward to have a great conversation with you and share my experiences and journey with you.
To start off, can you tell us what a hospital operation is exactly, and what a typical day of our operation managers look like, and what are the challenges hospital face in running smooth day-to-day operations?
So if I talk about operations, I want to start this with think about hospital operations as an engine room. That it's an engine room that runs the entire hospital and it ensures that everything functions smoothly in the hospital, be it patient care, patient management, doctor scheduling, infra management, inventory management, and billing, revenues, cost, everything is to be ensured by the hospital operations, clinical, non-clinical side, everything. And if I talk about the challenges that hospital operations people face, that are majorly, as we all know, that nurses short, the crunches everywhere in
Yeah.
the country. So that is the nurses shortage and also staff shortage because hospital is an organization which has to be run 24/7. And then there are, other challenges like inventory challenges we have. And then sometimes we also face challenges regarding finances of patients, doctor crunch. So all of these things are there, but still, since I said that it's a pivotal role and it is the backbone of the hospital, which has to be strong. So this is what a hospital operation looks like.
Okay. So, actually, in nowadays, we are seeing shortages, and of course, technology is also, you can say, technology is transforming healthcare. So, how have digital tools like EMRs, AI, or the telemedicine impact hospital operations?
So Dipanshi, actually, technology has actually been a game changer. In the hospital scene, it has actually been a game changer. It has transformed the hospital completely from non-clinical operations where bed management, pharmacy, inventory management, and everything is now on digital platforms, and to clinical side also where diagnostics, prescription managements, and quality management, patient safety management, everything is now driven by technology. It brings more of transparency.
Hmm.
It increases the efficiency of the staff. Now, staff, and it reduces the manual intervention paperwork. That it has actually drastically transformed the hospital scene. And with the coming of AI, the things are actually moving more on a faster pace and more towards more productive. hospital efficiency, like increasing the more hospital efficiency and on the more productive side, I would say. So, now with AI coming, we are more like the doctors, like AI help doctors to assist in predicting diseases and
Right.
predicting, like incidents which might happen in hospital, like, medication errors. It predicts that. It predicts incidents like patient fall. So, it is actually, I would say, the technology is actually a blessing for hospital staff nowadays. Yes.
Okay. As you already covered, there is lot of thing happening in hospitals in different departments. So, how do these hospital ensures the coordination across the departments?
Yeah. So as I said that with the help of technology, it has actually bridged the gap of communication. It has brought transparency in the hospital. So now there is no need of manually calling somebody and asking about the status of patient that and what is the course of treatment of that patient. Now everything is available on just a single click. So if I am a doctor or if I am a nurse and I want to see where my patient is, like patients, move within the
Yeah.
hospital also from ward to ward, from ward to diagnostic areas. So I don't have to ask somebody. I just have to click on in my HIS and see the status of patient that is his like for example, if my patient has gone for a radiology test, so I just have to click and see that his radiology test is done or not. And yes, and secondly, in before the technology has come, at that time, actually because of miscommunication and
Yeah.
communication gap, there were incidences where a patient, like life of a patient was actually at a question. So communication is one thing which plays a crucial role in patient treatment, and technology has actually bridged that gap for us.
Okay. So basically, it's a software you are trying to say. It's a software that hospital
Yes.
uses.
Yeah,
Okay.
it is not a single software, it is
Okay.
multiple software. So there are
Okay.
softwares for clinical performance, like for diagnostics, for pharmacy, for
Okay.
inventory management, for prescriptions management. Then there are non-clinical side of software, which are HIS, which looks
Hmm.
into billing, finances of patient, bed management of patient safety. There are like various kinds of softwares I'm talking about.
So Iram, also let us know how are hospitals using analytics and KPIs to improve outcomes?
So, before moving to that, I would like you to know what, basic goals and outcomes of hospital are and how they are measured. So we call it in our, like in hospital parlance, we call it KPIs, which is key performance indicator. So every department is, it is stitched to that KPI, and KPI is basically, they are end goals.
Hmm.
They are end goal of of every department
Okay.
where their performance is measured in the terms of that KPI only. So, for example, there's a KPI of a percentage of medication error. There's a KPI of percentage of patient fall, then percentage of patient returning to emergency with the same complaint within 48 hours. So um, this much extensive and deeply driven KPIs are there for hospitals, and these KPIs they can be both internally and externally. So internally is what hospitals decide for themselves, and externally is what other regulatory bodies like NABH and JCI they decide for hospitals, which are also mandatory for hospitals to achieve those KPIs.
Okay.
So this is what KPI is all about. And then if I talk about how do hospitals maintain those KPIs, they're actually very extensive and a large number of KPIs a hospital has to maintain. So for that, our like softwares like Medblaze and other quality management softwares, they have a dedicated module just for the KPI, which is called quality indicators module.
Mm.
So this module, the work of this module is that only that it fetches data from different sources like audits, normal hospital census, and normally, whatever the data is, it fetches from different sources, and then based on the permutation and combinations, it drives insights of that sources and tells the hospital like, see, this is the benchmark, like KPI is
Yeah.
benchmark. Okay, so this is the benchmark for this KPI, and you have either achieved it or not achieved it. So like this is how a technology is basically helping hospitals, because manually it
Mm.
is actually a tedious work.
Yeah.
And since manual work also brings, errors and lack of trust, so that is how a quality indicator or KPI is managed. And also it brings, trust of patients
Yes.
to the hospital. If a hospital is, doing so much, and because just to achieve one KPI, it takes a lot of efforts from the hospital side. So this is how a KPI works.
Okay, okay. Really interesting that is. So, from nowadays, as we are seeing, sustainability is a thing. So, and sustainability is becoming important everywhere. So, how are hospital addressing green operations or sustainability?
So hospitals are coming up with a very, innovative ideas with regards to environment and sustainability. So nowadays, actually, big hospital, if I talk about the corporate hospitals, they are hiring people specifically for this department, and usually, like hospitals are coming up with new green OTs, and they're installing solar panels, plantation drives are performed, and they are moving more towards paperless system, and
Okay.
conservation of electricity, water management, how water is recycled and used. So all these practices are performed in hospital for sustainability.
Okay. Okay. And if we shift ourselves to little finance, so in terms of finance, how do hospital balance operational cost or revenue generation?
I think this will be the most interesting topic which people would be more interested to listen, because this is a normal perception of people that hospitals might be earning,
Yeah.
a lot, because they think that they charge hefty amounts from that. But this is not actually the case. Uh, you know, um, Actually, hospitals, for a normal person, I would say yes, healthcare treatments and hospital treatments are a bit expensive for middle class people and lower middle class, if I talk about. But if you see on the other side, the cost side of the hospital, one machine, if you even see a normal ultrasound machine, that cost
Mm.
in lakhs and crores to
Crores.
hospital, and most of the machines, they are being imported. So actually, the cost of hospital is always on a higher side. That's why if I talk about, net profit, that is actually very low. So hospitals actually run on a very low EBITDA or net profit, if I say. And even for nowadays, government is also coming up with schemes, capping
Mm.
schemes. Insurances are coming up with capping schemes where hospitals have to restrain themselves to a certain limit where they cannot charge to a patient to above that limit.
Okay.
So for those people who think that hospitals earn a lot, let me tell
Yeah.
you, this is just a myth.
Yeah.
Hospitals are just surviving.
As we moving forward from sustainability, finances, the most hot topic will be about the pandemics. So hospital needs to be prepared for emergencies all the time, like pandemics or mass casualty events. So what are some best practices in the crisis management hospital do?
So the concept of contingent planning is a part of hospital planning, like since inception. So when a hospital is like when a hospital is designed or the processes are set up, they are set up in such a way that they can handle pandemics or unpredicted situations. So we also have a mechanism of risk management, which every hospital has to mandatorily perform that risk management. And risk management is actually mapping of risk or unpredicted situations to every department, dra- and then coming to a conclusion and finding out alternatives that can mitigate that risk. So hospital are the if I talk about the infra point of view of hospital, they are nowadays constructed in such a way that they can be expanded. So if a ward is having only two beds, but
Hmm.
if you see the infra of that ward might be constructed in such a way that it can accommodate more than two, like four beds also. So, and then regular mock drills of mass casualties, and mock drills of like situations like pandemic. So, excuse me, all these things are performed on regular basis. Hospitals have to update their tie-ups, they have to update their emergency supplies,
Hmm.
and even the hospital staff nowadays, they are trained in such a way that non-clinical staff, the ground level like housekeeping staff and F&B staff, they are also trained to give CPRs, so that in any emergency situation, at
Yeah.
least those staff are prepared for that. So, likewise.
As we are moving towards the end of our session or this interesting conversation, so looking at the future, what trends will shape hospital operations in the next 5 to 10 years?
So Debanshi, seeing the faster penetration of technology and AI into hospital operations, I would say that this is personally my opinion only. This is what I can, seeing the trends. I can say that hospital operations, till now it has been more of firefighting and reactive situation. But with the coming of technology, AI, predictiveness, and transparency, hospital operations will soon move towards more, preventive side and
Hmm.
increasing the efficiency in every sphere, like not only in patient management, in every sphere, clinical, non-clinical, revenues, supplies, everything. So I think better monitoring would be there, better transparency, digital advancements, and more patient-centric. It is going to be there. So operations would now be more of operational patient
Hmm.
excellence.
That comes to an end of this podcast. It was an incredible, insightful conversation with Miss Iram Fatima on the realities and the future of hospital operations. From managing patient flows and staff well being to integrating technologies and maintaining patient trust, we got a deeper look into how hospital truly functions behind the scenes. Thank you, Iram, for sharing such a practical and thoughtful insights and for giving us a better understanding of what it takes to keep a hospital running efficiently and compassionately.
Thank you so much. Thank you so much for having me here.
Thank you. To all our listeners, thank you for tuning in into our podcast. For more informative sessions, stay tuned and stay inspired. Thank you.